3. Right foot to the back. I'm looking towards the front. My right knee is touching the mat. Both feet together. Knees down, chin down. Look up. Cobra pose. Mountain pose. Right leg to the front. My left knee is touching the mat. Both legs together, both feet together, looking down. Rise up. Now let's start from the other side of the mat, left side. So in the 4th asana, my left leg will go at the back. 1, 2, 3, come down. 4. Left leg goes at the back. My left knee is touching the mat. Both legs at the back. I'm looking at the mat between the 2 palms. And my entire body is like in a straight line. Imagine the seesaw in a child's playground. Kind of similar to that. Knees down, chin down. Look up. Staring at the roof. Slightly broaden your shoulders. Mountain pose. I'm staring at my navel. Left leg to the front. Both legs together. Look down. Rise up. Now let's repeat the same thing from the right side. 1, 2, come up. 3, come down. Right leg to the back. Both legs to the back, plank pose. And the next pose, when I bring my chin down, my chin and my chest will be touching the mat. Then you're doing it right. Knees down, chin down. Rise up. You can extend your arms like this, or you can flex a little bit at the elbow. Both are okay, whichever you feel comfortable. Mountain pose. If you're doing it right, you will feel an intense stretch at the back of your leg. Right leg to the front. Both legs together. Look down. By now, your entire palm should be touching the mat, or at least half of the palm, without bending your knees. Rise up. Now from the left side. 1, 2, up. 3, come down. 4, left leg to the back. Continue slow, deep breaths between the asanas. Don't hold your breath. Both legs at the back. Plank pose. Knees down, chin down. Rise up, staring at the roof. Expand your shoulders. Mountain pose. Left leg to the front. Both legs together. Rise up. Okay. Let's start with some regular asanas today. The most famous tree pose with a slight twist variation. Tree pose is very good for balance and focus. So I'm starting with my right leg onto the left thigh. Avoid talking or looking at multiple things. Focus on something that is right in front of you. Now with my both hands, I'm going to do a namaskar from the back. And I'm going to show you later how it is from the back. Breathe. So watch what I'm doing at the back. My left leg comes up now. Instead of hands going up, I'm focusing on an object right in front of me and breathe. Ready? Let's repeat another cycle. Right leg. It's okay to hold on to something if you're falling. Please don't have any accidents. Namaskar on the back. Now the other leg. The left leg to the back. Sorry, the left leg on my right thigh. If you can't do the namaskar, just balance with your hands apart like this. And those who can do the namaskar. Very good exercise for focus and balancing. Even kids can practice this. This is, in fact, the most common exercise or asana taught to kids for ADHD, dyslexic kids, difficulty with reading, things like that. So these kind of asanas help improve their focus. Now, spread your legs apart. Up. So when you come up, you do the namaskar, and when you go down, spread your hands and hold. Hold up for the count of 5. 1, 2, 3, 4, 5. Come down. 1, 2, 3, 4, 5. Up. Come down. 1, 2, 3, 4, 5. Don't hold your breath. Continue deep breaths. 1, 2, 3, 4, 5. And notice that when I come down, I'm not leaning forward. One last time, I'm going to show you from the sides. So my legs are apart. Namaskar. 1, 2, 3, 4, 5. So when you practice, please practice like that. Now, squat pose. Both my arms are inside my knees, not like this. I'm inside the knees. And I'm looking in the front here. Up. So we're going to repeat 5 cycles. Ready? Down, squat, up. Down, up. Down, up. Down, up. Down, up. Very intense exercise, working your joints and thighs, especially in the winter season. They get very stiff with the joints. So this was a good warm up. Now Chakrasan. It's a slightly complex pose. So I want you to watch and practice them in the next few days if you can. So what do you do in Chakrasan? Lie down flat and look where my heel is. It's almost touching my butt. And look where my hand is. I'm not doing this. Okay? Not like this, like this. So my fingers are pointing towards my toes, not towards my head. And it's by my shoulder. So I won't be able to talk when I do the pose. But when I lift my center part of the trunk. And the weight is balanced between the 2 feet and the 2 palms. Let me show you one more time. Again, this is just for you to practice when you're watching the recordings. If you cannot do it today, that's okay. So my arms are here and I lift. Again, very good exercise for anti-gravity, improve the blood supply to the brain. and all that good asanas. Something to practice and learn. Now, remember I told you there are 1,000 different variations of plank pose. We're going to do some today. And every class, I think I teach you about 3 or 4 different varieties. So today we're going to do some variations of that. Plank pose. Come down to your elbows. Okay, ready? 1. So what I'm doing, I'm bringing my heel to the butt, close to the butt. 1, 2, 1, 2, 1, 2, 1, 2. Relax. Ready for the next cycle? 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Stretch. Fixing my headband. Now, different kind of a variation for the low plank. Okay. 1. So what I'm doing, I'm stretching my leg and I'm balancing on my toes. 1, 2, 1, 2, 1, 2, 1, 2. Okay, now let's do some stretches for the shoulders. So my left knee is below, my right knee goes above, my left hand goes above the shoulder, and my right hand is interlocking the other hand. And I'm looking in the front, breathe. Very good shoulder exercise and stretching. Now as a counter pose, bring your right knee, right leg in the front, and my left hand crosses across the right knee. My left hand crosses across the right knee to touch the left heel. And I'm looking at my back. Breathe. A big namaskar. And I touch the floor on the opposite side. for counter pose. So I'm going to show the next side looking at the front so that you understand from different angles how I'm doing it. So my left knee goes, sorry, my right knee goes below now. My left knee comes above over the right knee. My right hand goes above the shoulder like this behind, and my left hand is going to interlock the right hand. Breathe. A very good stretching exercise. You can stay in this pose for however long you want tomorrow when you want to practice. Now come down. Now the left knee or the left leg that was on the top comes in the front, and I'm taking the right hand across the left knee. I'm not doing this, I'm doing it across and touching the left heel, and with my other hand I am twisting the spine to look at the back. Breathe. A big namaskar. Now I'm touching the mat on the opposite side for counter pose. How does it feel? A good amount of stretch on your entire upper half. Give me 1 second. Let me adjust the doors here. Sorry for the break. I had to shut the doors to avoid the background noise. Now, we're going to do a twisting pose. I'm lying down on my back. Now, my right knee goes across the left leg. And see how I'm twisting the two legs? So my right knee is twisting the left leg. And now I'm going to twist the opposite hands, left across the right. Okay? So left elbow comes up. Left elbow is facing me. The right elbow is below. And this is the asana. Bring it, touch the mat above your head. Take deep breaths. Now bring the two elbows to the two knees, like this. When you bring the elbows and knees together, coincide that with your inhalation. So exhale, inhale, bring. Notice that this is crunching your belly fat and also helps in stretching your joints. Let's do cycles of 5. When you inhale, bring the joints together. Start. 1, 2, 3, 4, 5, Now I'm going to twist the other legs, okay? I'm bringing the left knee, twisting the right knee like this. And my right foot is still touching the mat. And I'm bringing my right elbow is facing me now. Touch the mat above. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's a good cardio workout and a good, strengthening of your joints. That must feel very good. Let's do some exercises for carpal tunnel. I'm massaging my right carpal tunnel using my left fingers. And I'm turning it like this. Twisting motions of the wrist. In one direction, now the opposite direction. So you feel like a good massage in the carpal tunnel. Carpal tunnel syndrome is very common, especially we're always working on the computer these days. So a lot of patients get carpal tunnel syndrome. Now I'm doing the other, massaging the other hand, the other carpal tunnel on the left side. Again, same thing. I'm pressing the carpal tunnel at the wrist joint with my thumb and fingers, and I'm rotating the left wrist. Both arms like this, up, down. Palms are facing up, down, up, down, up, down, up, down. The front, up, down, up, down, up, down, up, down. Now the shoulders. Keep your palms on the shoulders, on the knees, sorry, and do twisting movements on the shoe. First clockwise and then anti-clockwise. Don't lift the hands from the knees. Focus only on the shoulders. Now the other side. So all the neck muscles and shoulder muscles that are tight will loosen up. Since we have quite a bit planned for the face yoga, I don't want you to miss that. So I'm going to give you 2 minutes break to wash your hands, wash your face, and grab your favorite moisturizer, a dry towel, and what else did I say? The 3 things. Yeah, I think I message. Yeah. So those 3 things. Let's get it ready, and I will meet you here in 2 minutes. Make sure, and make sure your nails are not sharp, and it's not having long nails. Make sure, because we're going to use them to massage, and we don't want any cracks. So make it short, clipped nails, and no chemicals, dust, etc. 2 minutes. So I have my stuff ready here to show you what I use. We'll wait for another few seconds for everybody to come back. So this is what I'm talking about. So this is what I'm talking about here. You see, this is the face with the saggy skin here. This girl probably is in her 30s, 40s, not very old. And you see after, the face yoga, you can see the improvement. Maybe you can appreciate this better because it's a well taken picture. So you see, this is what we're trying to avoid, the saggy skin on the sides of the nose and the neck and around the eyes. So that's what we're going to focus on. And we're going to see what best we can do at home. First of all, let me tell you what I use, because there is, adjust the camera a little bit. So one of the important thing people use is the soaps, the bar soaps. They have a lot of strong chemicals that makes the skin dry and not recommended. So this is the gel that I use for my to wash my face. So I don't use a bar soap. So those of you who are using Dove, Lux, and all those bar soaps, please stop using them. You can keep them for dishes and clothes, things like that, but not for the face. General rule is anything that provides too much lather is going to have too much chemicals and it's going to make your face dry. So use something like this. And I have a dry towel here if you want to. So this is the moisturizer I use. I'm not advertising for any product. And again, you don't have to buy this, but I tried for the past 1 year or 2 years, I've tried 10 different moisturizers and, recommended by various dermatologists, um, physician friends and celebrities, things like that. But I kind of find this more suitable for me. But again, it's very difficult to say which one will be suitable for you because each of us skin is slightly different. The pores are different. Some of us have more hairs on the face. Some of us have more pimples on the face. We have some of us are more oily skin. Some of us have blemishes and dark spots. So this may not be 100% suitable for your skin, but I'm just showing you what I tried and has worked for me. And if you can also get this it's available on Amazon. You can try this. So the first thing we're going to do is take a good amount of moisturizer and make the skin soft. Because when we massage the face, we don't want any scratches to happen. So we want to make our skin soft. Now, for women, it's very easy to know the difference of a soft skin. Remember, when you make baturas versus roti. Baturas, when you press, your hands will go soft inside and it'll come up. It's plumpy. But for rotis, it'll be slightly harder, right? So that is the consistency we want for the face. We don't want roti kata. That's very hard. and you're not going to, it's going to create wrinkles, it's going to create sagginess. You understand what I'm saying? So try to keep the skin soft and plumpy, and the moisturizer, a good moisturizer, helps doing that. So I'm just applying these. So first, select the first step is, of course, to select a good moisturizer that suits your skin type. So it's always soft and plumpy, and on top of this, you don't you won't see any wrinkles, you won't see saggy skins and like that. So now to massage, I'm going to show you two layers, first down and then up. So lower cheek and upper cheek. So I'm going to hold with my left hand, I'm going to stretch this area near the eyes, okay, near the forehead. And I'm using only two fingers, the index and the ring finger. And I'm going to do like this. And the strokes will be upwards because we don't want to saggy skin down, right? So we want upwards. So watch. You can even turn like this if you want to. So let me show you like this. That's why I asked you to have your nails clean, because we don't want to put in more dust from the nails to the thing. So we do that like 20, 30 times. Now we go to the eyes on the upper cheek. Now this is below the cheekbone. Now we are going above the cheekbone. And now to the crow's feet. The crow's feet is here around the corner of the eyes. It's a very common area for wrinkles. So now I'm going to do the same thing for the other sides from the left cheek. And I'm using a little bit more moisturizer to avoid, So here also I'm holding it like this with my left hand. And I'm using my index and ring finger. Now I'm going above the cheek. Now it was below the cheekbone, now above the cheek. And I go towards the crow's feet in the corner of the eye. So when you keep practicing these techniques, you will see a good difference that your um, face is not sagging, but it's pulled up. Now we want to take care of the dark circles under the eyes. So just a teeny bit of moisturizer to the tip of the fingers here. And don't do too much also, because we don't want them to enter the eyes. And what I'm going to do is dab like this, very gently, like how you would touch a baby, like this, around the eyes. So what I'm doing is I'm shifting the fluid from around the eyes across the elsewhere. And then here across the nose. I hope you can see me. I have closed my eyes because I don't want any chemicals to enter my eyes. Again, our eyes are very important. That's why. So that's a good thing too. Now for the neck. Again, you can practice this, twice a day, 3 times a day, or whichever possible. Now, it's just a tad bit of moisturizers. And usually in the some of the videos they do like this, and then avoid doing that, because you're going to get saggy skin here and double chin. You don't want double chin. So like this, like a figure X, like this. And those who have lot of skin under the neck, this is after doing this, look up and pout your lips. And imagine you're kissing to God, like, kissing to the air above. Watch. So notice when you do that, your neck muscles gets really stretched, and you can feel that stretching. So let's try another time. Look up. You feel that stretching the neck. Now, one more exercise for the neck. When you look up, try to smile without showing your teeth. Let's try that. Look up. When you smile, without showing the teeth, you'll feel a stretch across the side area of the neck. So this gives you a nice lift of the neck and some shape of the neck. So let's try. Now, we usually for the massage, I always start from the head, face, and neck. But since I didn't want to make you wash again, because after we touch the head, we have to wash the hands again. So I thought we will do the head in the end. Now, just let your hair open and put your 10 fingers inside the hair and just press. Like, I'm not scrubbing, I'm just doing this, like as if I'm holding with my claws. So different points of the head. I start from above, let go, press, let go, down, press, let go, press, let go, press, let go. So that gives a good massage to your entire head, neck, and face. So please practice this and tell me how you feel. Now we can start with the rest of our talk on 7 ailments. Number 1 being hair fall. I know a lot of us have experienced the hair fall. Hair fall is very common. It can occur because of nutritional lacking, or because commonly, I'm telling you the common reasons, there are so many other reasons. The common reasons because nutritional deficiencies, or if you're taking certain medications. The most common culprits or medications that cause hair fall are psychological medicines and, of course, cancer medicines, chemotherapy, and all that. So these are the most common culprits to cause hair fall. Now, one good indication to know whether you have a nutritional deficiency or no, is to compare your nails. When you look at your nails, the nails grow at the somewhat equal rate to your hair, right? Because and you can actually see them. You can't see your other parts of the body growing. So, if your nails are not chipped, and some of the people, if you see, they don't even have, the nails won't grow after a certain point, and they will have something embedded and some lines and serrations. So those are all indications that you have some nutritional deficiency. Some of them have spooning of the nails, and so many other types. We'll have to go through another separate session to understand that. But that's an indication that you are nutritionally deficient, and that means your hair is also not growing properly. And we recommend any kind of multivitamins. You can use that. And usually hair fall is common when you go through some kind of a hormonal changes. For example, in women, we see after delivery, during lactation, because the nutritional requirements are so high, all of your nutrition is going to feed the baby. So you will have depletion and you will have a hair fall. In men, you see when they reach middle age, because of the change in the testosterone, they will see a hair fall. So that is very common. Again, these are common causes. Then there are some diseases, that alopecia and all the specific disease that cause hair fall, and those are more serious conditions. You'll have to go to the dermatologist. Now, for the most common reasons, one of the best remedy that I have tried is methi seeds soaked in water. Add a few pieces of amla, egg white, just a little bit of egg white, and coconut oil, like, not hard coconut oil, melted coconut oil. Grind these into a paste and apply it to your hair for half an hour. Leave it, not more than half an hour, and rinse it with a regular shampoo. So this works very good in strengthening your hair. And but some of them, beware, can cause headaches, because methi seeds is very powerful. So in that case, you have to reduce the amount of methi seeds. If you're using 1 spoon, use half a spoon, and don't leave it for half an hour. Reduce it by 20 minutes or 25 minutes, 15 minutes. It's just about trial and error methods. So, but it works very well for strengthening the hair. Number two is leg cracks. A lot of women, nowadays, when we, because of the winter or weather changes, water changes, we get leg cracks. One of the best remedy that I have tried is sesame oil. Apply them before entering the shower to the parts of the feet. Take a shower as always, with soap and whatever. And when you come out, it acts like a resin, because sesame oil, if you notice, it's very thicker. It's very denser than other oils, so it sticks to the cracks and it binds them naturally. And it also causes, it doesn't dry them, because mostly the dry skin occurs from dry skin is what leads to the cracked skin. So it acts like a resin, and it moistens the dry skin. So it acts like a good binding agent. Diarrhea. So when you travel from, especially to third world countries, and especially your kids may not be used to it, because the colonic bacteria changes when you travel. So if your child is having it's called traveler's diarrhea. If your child has a traveler's diarrhea, the best thing is to drink buttermilk, not yogurt. Buttermilk is more watery. You have to add 50 buttermilk, 50 of water proportion. Add a little bit of salt and a little bit of powdered jeera. Mix it and drink it. So that is very good too. It replenishes the colonic flora, and also reduces the warmth in the gut. So I'm sure some of these remedies are told by your grandmothers, by your mothers and aunts, and some of you already know, but I'm just trying to reiterate the fact that these are very healthy and you can still practice them. Number four is heartburn. This is usually common in the night after the dinner. And I've told in multiple sessions and before, the heartburn patients must be very particular about what time they eat dinner. Usually before 7 p.m. is a good time to eat, and you should not lie down for at least 3 or 4 hours after the dinner time. So what is heartburn basically is the acid regurgitating from the stomach to the esophagus. That is what is causing heartburn. So whenever the acid regurgitates to the esophagus upwards, that is called heartburn. Now, there are certain foods that makes the heartburn worse in people with these reflux problems. They are chocolates, tomatoes, pizzas, fried items, and hot soups, and heavy spices, things like that. So if you're regularly having heartburn, it's better to avoid these kind of foods in the evening or dinner time. So if you're used to American food, you can eat bland foods like pasta, or bread, like that. Simple things like salad. If you're Indian, you can use idlis, upma, dosa, something bland, so that doesn't activate your heartburn symptoms. Now, usually as a general rule, I'm always told my followers and patients 717 is a good time to follow. 7 a.m. dinner, 7 a.m. breakfast, 1 p.m. lunch, 7 p.m. dinner. If you stick to that schedule, then your gastric acid will get used to that timeline, and it will produce acid only at that particular time. So only when we have erratic eating schedules, then the acid or heartburn gets worse, because then it starts producing acid at all the times, and then you end up eating more, or you don't know what to do to counteract the acid, and then it makes it worse. So always stick to the 717 rule. And of course, heartburn is the number one reason for chest pain patients who come to the emergency room. They often get wrongly diagnosed as heart-related chest pain. Actually, the heartburn is actually the number one cause for patients to come to the ER with chest pain. So, you can actually avoid that by following these simple remedies. Another thing is, if you have heartburn, don't lie flat when you go to the bed. Lie in a slightly slanting pose where the head is not like completely flat, but it is 70-degree angle. That is what is recommended. Sore throat, early morning salt water gargling is the best. I always tell this even to my kids. After brushing, before you have your early morning cup of coffee or tea, do the salt water gargling. It will remove all the bacteria that is stuck in the back of the throat when you're sleeping. So when you're sleeping, you're in a lying down position. So all the bacteria just settles down in that area. So before you eat anything, after you brush, do the saltwater gargling, and it will remove 70 to 75% of the bacteria that is stuck in the back of the throat, and will help relieve the sore throat. And again, there are, ginger tea, ginger coffee that all our grandmothers and mothers have always recommended. That also works very well for sore throat. You can continue that. Insomnia. People often complain not able to sleep in the night. And there are so many reasons to that, but I'm telling you the most common reason, which can be avoided, which can be treated at home and can avoid going to the doctor or the emergency room. So there is something called a fancy name, restless leg syndrome. So what the patient will not come and tell you, I have restless leg syndrome. The patient usually will say, I'm tossing and turning in the bed, doc, I'm not able to sleep. So what happens with restless legs is, especially in winter, it's very common that when we stand and we are walking, the blood circulation in the feet is higher because of the gravity, right? So we feel warm and nice. But when we lie down on the bed, the blood is then shifted to upwards to the hands or to the upper part of the body. So our legs become cold. We don't realize that when we go, because it happens after we lie down after an hour or two, and then we feel very cold in the legs and we are not able to sleep, and then we are twisting and turning and tossing and turning, finding a suitable position. So the best thing I tell my patients is, before you go to bed, if you have that kind of a symptom, if this is what you feel is causing you lack of sleep, take nice warm ghee and rub it on the sole of the feet here. Hardly, nice, rub it hard, so much so that your hand and your feet should be warm. And ghee is a very warm agent, and it's very soothing and warm. So do that for both feet. Wear nice warm socks and go to bed. So that way the circulation and warmth is maintained in your feet. So you don't have to be, searching for a warm place for the legs. And also, this is just one of the reason. If you're already doing these above and you're still having this problem, then you could have iron deficiency anemia, because iron deficiency anemia can also cause restless leg syndrome. In that case, you will have to get your blood check done or ask your doctor about restless leg syndrome, and then they will suggest you to check the iron levels, and then you will have to take iron pills. So that's one of the reason. Hair dandruff. Now, this is the most tricky thing. Um, And dandruff is one of the most important cause for hair fall. Remember the first method I told you with the methi seeds and amla? That is not going to work if you have dandruff. So you have to first get rid of the dandruff before you try anything else. I know there are a lot of anti-dandruff shampoos in the market. They work well, but they also make your hair very weak and brittle, and you get split ends and all those things. So the best remedy I have that has worked for me is take one large spoon of neem oil and one large spoon of coconut oil, warm it up and apply to the scalp. Don't leave it for more than an hour. Just leave it for 1 hour and wash it nicely. So your hair should not have any oil left when you wash with the shampoo. Now, this is slightly different from what we practiced in India. So, in India, I remember when I was going to school, all the 5 days that my mom would put oil and send to school. And it was fine. Because remember, the biggest difference between the Indian method and here is the humidity. So, a lot of people, when they come from there, suddenly when they come here, they experience hair fall. It's because of this, because they leave the oil in their head for too long time. And that is not going to work for Americans, because here the humidity is very low, the dryness is more. So the oil doesn't get absorbed, the oil just stays in your hair, it gets dry, it gets flaky, and then becomes dandruff. So but in India the humidity is so high, so our mothers would always put oil and braid it, and the oil would actually not stay, it would go away the next day, and again she would put oil and it would be fine. And actually the oil will help us reduce the humidity from the head, right? Because we're walking on the streets and the sun is directly hitting the scalp. So the oil is actually protecting in India, but here in US you have to be, it's very tricky. So that's why I said do a mixture of neem oil and coconut oil and leave it in the hair not more than 1 hour and wash it off nicely. Please don't sleep with it, because I've seen a lot of patients doing that who sleep with the mixture and come back with headaches and dandruffs and sinus problems, cough problems, so many things, and asthma. So don't do the mistake. Wash it nicely and leave your hair dry. So, I always wash twice a week with this recipe, but I keep my hair dry. Yeah, there won't be any oil in it. So that's a slight difference between the two countries. So you don't have to stick to your mom's and grandmother's recipe here, because there is no humidity in this country. Humidity is very low and dryness is high. So you have to change it accordingly. So those are some important tips that I wanted to share with you. Now let's just pray quickly, meditate for 1 minute or 2 minutes for everybody's well-being. Start. Gently open your eyes. Thank you for joining me. We'll see you again on Thursday.
Thank you.
Thanks, Ramana.